Staphylococci are gram-positive cocci that occur in grape-like clusters. There are more than 45 species known. Many of them are part of the normal commensal flora of humans. Staphylococcus aureus is the most important human pathogen amongst the staphylococci, commonly causing localized suppurative lesions, but it can cause disseminated infections as well. How does this microbe look like? Staphylococci are spherical cocci, approximately 1 micron in diameter, arranged characteristically in grape-like clusters. They are non-motile and do not form spores. One of the reasons why staphylococci are considered to be dangerous is because of their high resistance to antibiotics. Before antibiotics were discovered, it is thought that staphylococci were affected by penicillin. However, soon after penicillin started being commonly used, penicillin-resistant strains of staphylococci developed. Now, how does this resistance work? One way is through production of beta-lactamase or penicillinase, which inactivates penicillin by splitting the beta-lactam ring. These are inducible enzymes which are plasmid mediated. They can be transmitted by transduction or conjugation. Penicillinase producing strains remain sensitive to penicillinase resistant penicillins such as methicillin and cloxacillin, while the beta-lactamase strains are sensitive to beta-lactamase inhibitor combinations like amoxicillin with clavulanic acid. I'm sure you must have heard of MRSA. It stands for methicillin-resistant Staphylococcus aureus. Let's understand how this mechanism of resistance works. Alterations in the penicillin binding protein PBP2A along with changes in bacterial surface receptors reduce the binding affinity of the beta-lactam antibiotics. These alterations to PBP2A happen because of a set of chromosomal genes called staphylococcal cassette chromosomal MEC genes, in which the most important is the MEC-A gene. This mechanism gives Staphylococcus resistance to all penicillinase-resistant penicillins like methicillin and cloxacillin. Majority of these strains also show resistance to other antibiotics like erythromycins, tetracyclines, aminoglycosides, and can cause outbreaks of hospital infection. A newer type of resistance has been developed in some strains of Staphylococcus aureus to vancomycin. These strains are now called as vancomycin-resistant Staphylococcus aureus. These strains have been shown to have VAN-A and MEC-A genes. These strains are a major cause of concern as they are highly resistant to antibiotic therapy and only linezolid is effective against them. Staphylococci produce two types of diseases, infections and intoxications. In infections, the cocci gain access to damaged skin, mucosa or tissue sites and colonize by adhering to cells or extracellular matrix, evade host defense mechanisms and multiply, thus causing tissue damage. In intoxications, the disease is caused by the bacterial toxins produced either in the infected host or preformed in vitro. Staphylococcal infections are among the most common bacterial infections and range from mild to fatal. They are characteristically localized pyogenic lesions, which is in contrast to the spreading nature of streptococcal infections. A few common pyogenic Staphylococcus aureus infections are boils, abscess, carbuncle, and impetigo. Staphylococcus aureus can also cause cellulitis. It is also a common reason behind wound infection. The common toxin-mediated staphylococcal diseases are food poisoning, toxic shock syndrome, and scalded skin syndrome. Coming to the lab diagnosis, let's first discuss how to collect specimens for testing. The specimens to be collected depend on the type of the lesion. For example, pus from suppurative lesions, sputum from respiratory infections. In cases of food poisoning, feces and the remains of suspected food should be collected. For the detection of carriers, the nasal swab is the usual specimen. Swabs from the perineum, pieces of hair and the umbilical stump may be taken in special situations. The diagnosis for Staphylococcus aureus can be made by culture. Staphylococcus aureus grows readily in commonly used culture media like nutrient agar and blood agar. The optimum conditions for growth are a temperature of 37 degrees Celsius and pH between 7.4 to 7.6. On nutrient agar, the colonies formed are large, around 2 to 4 mm in diameter. They are circular, smooth and shiny. Staphylococcus aureus characteristically produces a golden yellow pigment which does not diffuse into the medium. Also, On nutrient agar, the growth of Staphylococcus aureus presents with a characteristic oil paint appearance. Now, let us discuss the coagulase test, which is done for identifying Staphylococcus aureus. The coagulase test can be done using two methods, tube and slide. The tube coagulase test detects free coagulase. It is an extracellular product of Staphylococcus aureus. About 0.1 ml of a young broth culture or agar culture suspension of the isolate is added to about 0.5 ml of human or rabbit plasma in a narrow test tube. EDTA, oxalate or heparin may be used as the anticoagulant for preparing the plasma. Citrate is not recommended because it may be utilized by some contaminant bacteria, causing a false positive. Positive and negative controls are also set up. The tubes are incubated in a water bath at 37 degrees Celsius for 3 to 6 hours. If positive, the plasma clots and does not flow when the tube is tilted. Continued incubation is not recommended as the clot may be lysed by the fibrinolysin formed by some strains of Staphylococcus. The slide test detects bound coagulase. For the slide test, the isolate is emulsified in a drop of saline on a slide. After checking for absence of autoagglutination, a drop of human or rabbit plasma is added to the emulsion and mixed. Rapid clumping of the cocci indicates a positive test. Positive and negative controls are also set up. The problem with this test is that it may sometimes show a false positive with coagulase negative strains. Alright, now if you have confirmed that Staphylococcus aureus is the cause of infection, what will be the management? As drug resistance is very common amongst Staphylococci, the appropriate antibiotic should be chosen based on antibiotic sensitivity tests. For example, benzyl penicillin is the most effective antibiotic if the strain is non-penicillinase producing. Methicillin was the first compound developed to fight resistance due to penicillinase production by Staphylococci. However, because of limitations in clinical use of methicillin, cloxacillins are used instead against penicillinase producing strains. Whenever MRSA strains are identified, vancomycin is a drug of choice. And lastly, for vancomycin-resistant Staphylococcus aureus strains, linezolid is a drug of choice. Alright, that's it for this video. Let's do a quick recap. Staphylococci are spherical cocci, approximately 1 micron in diameter, arranged characteristically in grape-like clusters. They are non-motile and do not form spores. Staphylococci produce two types of diseases, infections and intoxications. In infections, the cocci gain access to damaged skin, mucosa or tissue sites and colonize by adhering to cells or extracellular matrix, evade host defense mechanisms and multiply, causing tissue damage. In intoxications, the disease is caused by the bacterial toxins produced either in the infected host or preformed in vitro. Staphylococcus aureus grows readily in commonly used culture media like nutrient agar and blood agar. The optimum conditions for growth are a temperature of 37 degrees Celsius and pH between 7.4 to 7.6. On nutrient agar, the colonies formed are large, around 2 to 4 mm in diameter. They are circular, smooth and shiny. Staphylococcus aureus characteristically produces a golden yellow pigment which does not diffuse into the medium. Also, on nutrient agar, the growth of Staphylococcus aureus presents with a characteristic oil paint appearance. A few common pyogenic Staphylococcus aureus infections are boils, abscess, carbuncle and impetigo. It can also cause cellulitis. It is also a common reason behind wound infection. The common toxin-mediated staphylococcal diseases are food poisoning, toxic shock syndrome, and scalded skin syndrome. As drug resistance is very common among staphylococci, the appropriate antibiotic should be chosen based on antibiotic sensitivity tests.